So, Alexa, which is the most difficult subject for first year medical students?
Oh my god, Subha. Obviously, it is anatomy.
So, do you want me to tell them everything about anatomy, how to make it easier from my expertise? Because
No, because Google is better than you.
well, Siri is better than you. Anyway, so hi everyone, I'm Dr. Subramnani, currently an intern in Delhi. Yes, finally an intern doctor. So if you want to follow my intern life in and out of the hospital, I post daily updates on my Instagram. Anyway, I still remember the time when I started with anatomy as a subject in my first year, and it was very difficult and tiresome. I'm sure many of you can relate with me right now, but don't worry, I have just the right series from you. From being a medical student to being a doctor, I have devised methods and strategies that not only gave me the knowledge to pass my exams, but also became the foundation towards making me a good doctor. I will cover the subjects such that their knowledge becomes more high yield and builds a strong foundation. So without any further delay, let's jump right into it. We will be starting off with anatomy. But why anatomy? Anatomy is a subject which is feared the most and even hated by first year medical students. They look at the names and the structures of the body and they are all confused. But let me tell you one thing, anatomy is a beautiful and very interesting subject when studied with the right approach. Imagine yourself as a surgeon and you need to penetrate the abdomen to access the organs. For that, you need to cut through many layers with the scalpel or go through them until you reach the organ finally. Without the knowledge of what is between the organ and the skin, you cannot execute it. Another example is Dr. Sean Murphy, the good doctor. He would analyze all the internal structures, imagine their positions, and find out the path for treatment efficiently. Imagine doing that. It will definitely make you a good doctor. Let's first understand the definition of anatomy here. The study of parts of the body dealing with their position and relation with one another. That's anatomy. Coming to the learning outcome of this subject. What are you expected to know after you finish studying anatomy? So, by the end of studying the subject, you should be able to build a right foundation for your knowledge in more clinical subjects like surgery, radiology, and etc. So, you can imagine the correlations and identify the root of all the problems. So, basically, a base. So, what are the resources that you should use for this subject? How to study anatomy basically? See, the internet is flooded with anatomy resources all over the place. But you have to find the right ones, and I will help you in that. First of all, let's discuss the approaches. There are two approaches on studying anatomy. This depends on what part of the world you're studying from. So, mostly in the European and Caucasus region, like Armenia, I and the professors made us study anatomy in a different way. A system wise approach, like a skeletal system, then the muscular system, then the nerves and all. So it was a system wise approach. Then comes the other areas like India and most countries, the approach is followed more regional. For example, thorax, so the skeletal system, muscles and nerves and organs of the thorax region, and then the upper limb region, then the abdomen region, and etc. etc. I personally feel the best way to approach this subject is the regional way. For example, the thorax and then all the organs and everything there, rather than the whole system wise approach. So anyway, what are the best resources? Let's start with the books. So here are some of the books which are very good for anatomy. For studying, there is BD Chaurasia, Gray's Anatomy for students, for all the gross anatomy. For neuroanatomy, you should look at Snell's neuroanatomy. For diagrams, the best, the Bible, it is Netter's Anatomy. For histology, you should refer to Histology Universe. And to know more about this, check out this video right here where I discuss more about this free resource. Now coming to digital apps and websites. You all know this probably, Biodigital Human. It is a free resource that can be added as a Chrome extension and you can dissect the body layer by layer, and it is a very innovative way to look at the body. And then we have my favorite app, Clinical Anatomy, which is now branded as Clinical Anatomy 2022. Now this is a great app and by far the best one. I've used it extensively in my first year and I still remember the vivid 3D models I used to make in this app. So on this app, you can, basically study all the layers, part by part. For example, you can start on the skin, then remove the skin and see the subcutaneous fatty tissue, and basically remove layer by layer and see everything in a 3D way. So basically, whatever you see in the Netter's Anatomy Atlas, just imagine it in 3D, or don't imagine it, just download the app and look at it in 3D and you can study anatomy like that. Very interesting, right? So now that you know the resources, books and apps and everything, what are the most high yield topics or the focus points of this subject? So, some of them are like neuroanatomy, different germ layers and derivatives, and I'll list them out here. And I'll have the list in the description box below so you can download it and keep a safe copy somewhere when you start studying such subject after this video, probably. But the best way to approach studying it is the clinical way. So, clinical way, let me ask you a question. You are presented with a patient with a winged scapula. Okay, the scapula is winged. What is your diagnosis? Why does the scapula appear winged? So there is a muscle called the serratus anterior muscle, and this muscle anchors the scapula towards the thoracic cage. Now these muscles definitely have some nerves innervating it, so this has the long thoracic nerve innervating it. So let's say this long thoracic nerve is damaged, that means that this muscle cannot function, that means it cannot anchor the scapula towards the thoracic cage, and that's why the scapula appears winged. Interesting, right? You just made your anatomy, the bookish anatomy which you studied, the names and all, way more interesting by tying a clinical concept into it. That's how you should look at anatomy wherever you are studying it from. Books, app, medical school, lectures, online video resources, anywhere. Just try to make it more clinical and look for the clinical correlation with the anatomy you are studying right now. So, what to integrate anatomy with? I had mentioned that anatomy is your foundation and has extreme importance in clinical subjects like radiology, surgery, ortho, musculoskeletal system, obstetrics. And when studying anatomy, imagine you are building a base to understand all these subjects better, and you will be good to go. Let me know which subject you want to cover next, because that's all for today's video. Stay safe, stay happy, and stay mad, but just about medicine.